Are you tired of hearing, have you tried this medication or have you tried this therapy, and yet you're still feeling stuck despite trying all these different things? You're not alone. In today's video, I'll be talking about why this happens and what steps you can take when it feels like nothing is helping. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. This topic is based on a viewer question from X, who says, depression, anxiety, PTSD, currently on Prozac, Wellbutrin, and clonazepam, doesn't feel like it's working. Also elderly, 30 years of Klonopin, serious problems with ADLs. Nothing seems to work. Thanks, X, for this question. First, let me expand on the question. This is my own commentary and not additional information that I got from X. Klonopin is the brand name for clonazepam. It's a benzodiazepine that, in psychiatry, we use to treat anxiety. ADL refers to activities of daily living. Your ability to perform ADLs is one way to measure how you're doing overall. Basic ADLs are things like personal hygiene, which include bathing, brushing your teeth, and other grooming activities. Other basic ADLs include feeding and toileting yourself. Instrumental ADLs are things like taking your medications correctly, managing your finances, and shopping and meal prep, and house chores. Now, X said they have serious trouble with ADLs. Elderly people can have trouble with ADLs because of weakness and balance problems. Thinking and memory can interfere with some of the instrumental ADLs, but these difficulties are not related to psychiatric issues. So let's take age-related factors out of the equation for a minute. Severe depression and anxiety, depression more than anxiety, can cause people to lose function in these areas. One of the questions I typically ask depressed patients is how often they are bathing. For someone who's not depressed, that might be an insulting question, but I commonly hear people tell me that they're only bathing once a week or once a month. You may go 6 months without brushing your teeth. Why? Because severe depression can make everything hard. Every task can take all of your mental energy. It's also fairly common for someone whose mental health is moderately to severely compromised to spend the entire day in bed, not lying on a couch binge watching a series, but lying in bed, ruminating, or just staring into space with maybe the television playing in the background. That's one way it can look when your mental condition causes moderate to severe impairment. One of the ways we measure how much your illness is affecting you is by looking at your activities of daily living. One more comment about X's situation is the benzodiazepine. Long-term use of benzodiazepines contributes to slowed thinking and compromised memory. It can also cause balance problems in the elderly. Clinically speaking, anyone over age 65 is considered elderly, and that's not my definition. But there's no universally agreed upon definition of long-term use when it comes to benzodiazepine or sleep aids. Some clinical guidelines will say to limit sedatives and sleep aids to only 1 month, whereas some research studies will use 6 months to a year as the outer limit of use. In my own experience, if I'm starting someone on a benzodiazepine, I will tell the person not to worry about dependence issues for the first 3 months. And then after that, if they still need it every day, we should look at other options to address their anxiety so that they don't need to take it every day. That said, there are people who take benzodiazepines every day for years, like X, without it being a major issue, except for the negative influence on thinking and balance. The slowed cognition issues vary in severity. Let's say you're in your 30s and you've been taking a benzodiazepine for 10 years. In your case, the slowed cognition may feel like you're not as sharp as you used to be, but it doesn't seem to make much of a difference in your performance. In fact, you may not even notice a difference unless you get off the benzo and see the difference in your clarity. In an older person, the cognitive changes may be more significant, causing confusion and trouble with problem solving and managing money. So if X is having trouble with some of the instrumental ADLs, it could be age-related, mental health-related, or the effect of medication, or all of the above. Okay, so that's my commentary on X's regimen and things to consider when it comes to how X is doing clinically. When it comes to figuring out what X should do in the face of the many medication options not working, the first step is to redefine what working means. When your mental health is declined, you likely have multiple things that are not right. And chances are, some of the things that started out as a problem may have gotten better, but then be replaced by other problems. And this distinction matters because what you need to do to address one problem may not work for a different problem. The medications don't wipe out everything. And what tends to happen is you become progressively reliant on the medication to be the thing that makes everything better. And this is especially the case for people who have multiple things affecting them, have had multiple medication failures, and don't spend that much time talking to their provider, giving details about the status of their individual symptoms. When everything is not better, you feel demoralized and hopeless that nothing that the doctors are going to do will help you. So how do you sort this out? You start by identifying your target symptoms. Everyone with depression does not have the same symptoms. Target symptoms are the things that you experience that are not normal for you. For example, for depression, you could ask yourself these questions to recognize your symptoms. How's your energy? How's your appetite? Are you snapping at people or crying a lot? Are you having trouble getting out of bed? Look at the things that you're not able to do that you want to do. What does your anxiety look like? Is it worry? If so, what about? Do you have physical symptoms that come along with your anxiety? Do you have thoughts that you can't get out of your head? If so, what are they? And when it comes to your thinking, do you have trouble remembering things? If so, what does this look like? For example, do you get lost driving home? Do you have problems putting thoughts together or paying attention? And if so, when did it start? What kind of problems does it cause for you? These are just some of the questions that you can ask yourself to identify your target symptoms. Write these things down. These are the symptoms that you and your provider are going to track for improvement. Your provider will ask about them in your appointment, and you should monitor how your symptoms are changing in between appointments. I can't tell you how many times I've had someone tell me, I don't think the medicine did anything, and I feel the same. Then I ask about their target symptoms. I don't call them that in the session, but I'll say something like, you told me you cry every day. Are you still doing that? The person may say, actually, no. I think I've only cried a few times since I saw you last. Then I say, you were having daily panic attacks. When was your last one? Oh, it was a few days ago. When they hear the comparison between what they told me about their target symptoms and what their symptoms are like now, they realize, I guess I am better. In those instances, it's a perception issue. They are by no means 100% better, but in their minds, the existence of any symptom means that they're not better and the medicine did nothing. Now, the reality is 100% improvement isn't realistic. What's more reasonable is that your symptoms improve significantly, with maybe some of them going away completely, but some of them remaining at a lower level. For example, let's say you're angry every day to the point where you're yelling and snapping at people. It's causing relationship problems and even putting your job at risk. A reasonable goal would be to have enough improvement where you don't have the urge to curse people out all the time, but you can't expect to never get irritated or lose your temper, especially when under stress. So what you want to do is make a list of your top 3 to 5 most bothersome symptoms. Then consider what improvement would look like for each of those symptoms. This is your desired endpoint. For example, is it reducing the severity of your anxiety from 8 out of 10 to 4 out of 10? Is it being able to leave the house twice a week instead of 0? Is it being able to pay attention long enough to finish your assignments or get a good night's sleep at least 5 nights a week? Research shows that complete remission, especially from the chronic conditions like PTSD, is less common than partial improvement. The 2006 STAR-D study, which was one of the largest antidepressant trials, found that only about 67% of participants achieved remission after trying multiple medications. This means about 33%, or a third of the people, remained fairly depressed after trying 4 different approaches. If you fall into this group, it doesn't mean that medication is useless. This data highlights the importance of holistic treatment. Therapy, lifestyle changes, and social support all play a huge role. And it's easy to fall into the trap of thinking, if this pill doesn't work, maybe the next one will, without considering any other interventions. A holistic approach to achieving mental wellness, even in the face of having active symptoms, is focusing on your nutrition, prioritizing sleep, and increasing your activity. And in this context, activity includes exercise as well as structure and a daily routine. Behavioral activation is a very underutilized approach to addressing the lack of activity and poor functioning that comes primarily from depression, but can be present in someone with multiple disorders like X has with anxiety and PTSD. When you combine all of those conditions together, they can really reduce your functioning level. Activity begets more activity, and small wins bring on greater accomplishments. So don't get discouraged if your progress looks different from what you imagined it would be. I have a behavioral activation guide that is a digital workbook that can help you develop a plan to increase your activity and improve your mood and wellness. It's called the Life in Action Workbook. It's got an activity tracker, a values assessment chart to help you identify meaningful activities, and an activities menu to give you ideas for activities to add to your daily routine. When you're not doing well, it's hard to come up with these ideas on your own. You can find the workbook link to this video, but you can also find it at the mentalwellnessspace.store. For help with nutrition, watch my nutritional psychiatry playlist. In that playlist, I talk about your gut and probiotics, the benefits of the supplements curcumin, magnesium, and vitamin D, the Mediterranean diet, intermittent fasting, and the negative effects of trans fatty acids. That's a lot of stuff and a lot of things that you can do to take agency over your health so that you're not solely dependent on medication to get you to the finish line. Medication can be a big help, no doubt. I still prescribe medication, but it's not the only thing that can help you feel better. If these nutritional interventions seem overwhelming, just focus on one or two at a time. Start small and then progress from there. You're not alone in this journey, and I'm happy to be here to help you help yourself. And there are many other health experts online doing the same work that I'm doing. You have access to a lot of resources that weren't available as recently as 5 years ago. Thanks for watching. See you next time.